because I know people have tuned in all over. We will be taking you through what occupational therapy is with my team. One of our presenters is called Boniface Kaimeni and Binti Hamisi. So the reason why we are conducting this webinar is to officiate, or rather celebrate the World Occupational Therapy Day, or rather week, here in Kenya. And also our main aim is to mobilize the whole country, the staff of Kenyatta National Hospital and the county hospital and the world at large. So we will be having our two presenters taking us through their various specialization, and we will just start right away. So the World Occupational Therapy Week, our theme for today is opportunity plus choice equals to justice. Our sub-theme is empowering everyday's life. And as we progress with the discussion, we are going to see how the opportunity, choice, and justice synchronize together in terms of now in our practice in OT. So I know a lot of people are asking what occupational therapy is. And OT is a client-centered health profession concerned with promoting health, well-being through occupations. And people will ask themselves, what is this occupation that we're talking about? So occupation refers to the everyday activity that people do as individuals, family, and with communities to bring meaning and purpose to life. So these occupations, they may include the things people need to do, if it is working, what you want to do, what are you interested in, and what are you expected to do as an individual, because we are staying, we are living in a community setup. So here at Kenyatta National Hospital, we have the occupational therapy process. What do I mean by occupational therapy process? It's when you visit our facility, there are procedural factors that you're supposed to follow. So when we have received a referral from maybe a general practitioner, when they come to our department, that is occupational therapy department, the first thing we do screening of our patient. And basically screening it's all about understanding the patient's problems and the goal of therapy. So over here now we use observational skills, we use interview skills to screen our patients. And then now we come up with a comprehensive functional goal depending on the needs of the patient. And then after screening, now we will go to the evaluation part of it. And this involves checking the client's understanding of the program. That is the goal that you've set for the client, and whether they are interested in the offered intervention. Remember, I said we are a client-centered health profession. So we can't go ahead with our plan if our patient does not give us a go-ahead. So after evaluation, we will now go into the intervention. And this is now where the client is helped according to their problems or needs. And my two colleagues are going to expound more on that, on now how do we intervene to, to tackle a certain condition. That one we're going to discuss as we continue. So in occupational therapy, department, we have services that we are offering here at Kenyatta National Hospital. And number one, we do training, functional independence in activity of daily living. That is, be it feeding, pressing, toileting, and bathing, and even more. We have the instrumental ADLs, shopping using a telephone, financial management, and etc., etc. Number two, we do sensory integration therapy for children with processing disorders, e.g. autism spectrum disorder. One of my colleagues is going to expound more on that. The third service we offer is we do training in delayed and regressed developmental milestones, either caused by cerebral palsy, Down syndrome, or any other condition. Number four, we do facilitation of oral and communication skills. If you have weak oral muscles, the OT is now able to work with you to gain your muscle strength, your oral muscle strength. And if you've lost your communication skills, be it due to an illness or you've regressed, then the OT now will be able now to, rehabilitate you in terms of now in your communication skills. We also do driving assessment and rehabilitation services for persons with disability. And just to echo out this, it's only Kenyatta National Hospital Occupational Therapy Department that offers this kind of service. So if you know someone, you can refer to us and he or she will be helped. Another service that we offer, we do home and workplace assessment and modification. In the OT process, when we feel like after you're from the hospital and you're going back to the community and you're not functional enough, we'll be able now to go back to your home and your workplace and do a little bit of modification so that you're able to perform your occupation. We do provision of assistive devices and adaptations, i.e. we have splints, we have bathing aids, we have sitting aids. Another service that we offer, we do lymph edema and scar management in occupational therapy. We do hand therapy. And just to again echo out, we have a hand therapist specialist at our department. So if you have any issues with your hands, then now you'll have to come to OT. We do a lot of adult neurorehabilitation, that is stroke and Parkinson's disease. And then lastly, we do enhance mental well-being to support performance and participation in the various occupations that we have mentioned. So a lot of people will ask themselves, who needs an occupational therapist? And where do we work? So basically, an OT will help people of all ages. If you have an issue with your physical abilities, social abilities, sensory abilities, mental or cognitive problems, then definitely you will need an OT. So from an early age of a toddler to the geriatric cases of an elder, if you are unable to perform your occupation, then now you will need an occupational therapist. So the OT services, we have other places where you can find an occupational therapist. It's not only in the clinical setup, like here in Kenyatta National Hospital. We also have schools. We have occupational therapists working with our children in school to enable them perform that occupation. If they have different talents or different special needs, then the OT now is able to go into their world to try to make them perform that occupation. We work in the community settings, that is community-based rehabilitation. For example, we have OTs working in Kibera slums. We have OTs working in Mukuru kwa Jenga. We also work in industries in terms of now, advising on ergonomical aspect of things. We do home settings. we work in geriatric homes, that is for the elderly, and one of my presenters, Binti, will be able to expand more on that. And then now we work in a mental health setting. And now that's why now today we've come to tell you some of our roles in mental health. So we will ask ourselves, why mental health? So mental ill health is the leading cause of disability in the world. Because since COVID came, we've had a lot of mental health cases, and in the world it is, it is categorized as the leading cause of disability. So the need for action on mental health is indisputable and urgent. It is very urgent. The health is integral to our well-being. It is very important if we have good sound of mind. So everyone at some risk, everyone has a risk of developing a mental health disorder. So it is not given to a certain group of people. It can affect me, it can affect you, it can affect your relatives, So, and this is a very important stage in everyone's life. So if we have a good sound of mind, then we are able to now, perform our occupation. And if you are not able to do this, and then now you will need now an occupational therapist. Yes. So now I'm trying to synchronize occupational therapy and mental health. So OTs in mental health help individual or groups of people to cope up with the stresses of life. We have different stresses of life, realizing their potential, participate in their productive, and contribute to the community. So the OT will help you. If you've lost your function, then the OT will now rehabilitate you back to your community so that you can go back to doing your occupation, or the OT will work with you to look at which other occupation will basically promote your productivity. So according to the World Health Organization, it reports that transforming mental health for all, when included in the task force, occupational therapists can help Kenya achieve a meaningful progress towards better mental health. So you see how important now an OT comes in, because if you're not able to function very well, then basically you can't do your occupation. So if you've seen anyone in the community that is unable, to be productive, then feel free to walk in any of our departments across the country, and you will be helped. So mine was to just give an overview of what occupational therapy department at Kenyatta National Hospital do, and generally where we work, and where, or rather, how can we help our clients, perform their occupation. So I think that is it from on my side. I will welcome Mr. Boniface Kaimenyi to take us through his area of specialization. And just to mention, if you have any question, we can chat on the chat box. If you have any questions, you can post it there so that now we can address it as we come to the end of our presentation. So feel free, feel at home. Welcome, Mr. Kaimenyi.
Thank you very much, Mr. Baron. Just a minute. share my screen. Very well. I hope you can see my screen. Good. Hope we are good to go now. So, thank you very much, Mr. Baron, for the wonderful introduction. And allow me also to proceed from where you left. And as we continue to have this discussion of mental health, on my side, we are going to look at it from pediatric population. And I will take you through on the role of occupational therapy in pediatric population. So let's start. Good. So my colleague earlier on did mention what occupational therapy indeed is. And maybe I'll just to, before now we go to the reading of the mental health and pediatric, allow me to mention that what is, we do help people to engage in occupation that they want, need to, and are expected to do. I think if you can see in my screen, I've underlined where we have that occupational therapy engage in occupation they want to, need to, and are expected to do. I think if you look at it that way, everybody, even whatever we do in everyday activities, whatever you do is something that give you satisfaction. Maybe that's why probably you wake up very early in the morning, you go to work because it really gives you the satisfaction to do that. And now you'll be looking at it. What happens if you are unable to do what you want to do, need to do, and expected to do? So on the area of mental health, my colleague also mentioned about it. So I'm not going to dwell on that so much. We'll go straight to the point. So the role of occupational therapy in pediatric population, one of the areas is, and it's really coming up, is the area of sensory processing disorders. Over the years, we've had the increase of these cases, and really it is a problem to the society because the kids cannot be able to participate in the occupation. In this case, could be schooling, play, which help in child development. Therefore, then we will be looking at what happens and what should be done. So just to give you a brief introduction of what sensory processing disorder is a process in the brain that organizes sensation from taking from environment, making it possible to use the body in doing activities of daily living. The bottom line here is somebody has to do the activities of daily living. So if you cannot be able to, pick information from the environment, organize the information, and then be able to give a feedback, then we end up now with the problems. I mean, with some of these challenges. If it's a child, the child cannot be able to participate, maybe in schooling, sitting down, even in feeding, toileting, uh, etc., etc. So, sensory processing disorders result when one's brain fails to modulate, discriminate, and organize the sensory information effectively. So that's where now we start having, or rather experiencing, some of these challenges. So next one. So ideally, this information is coming from an environment. So what picks this information is the body senses. And ideally, human being has 8 senses. As you can see from the screen, we have tactile, that is responsible for touch. We have visual for sight, vestibular for balance, olfactory, this is a sense of smell, auditory for hearing, which means if somebody calls you, you can be able to hear and respond. Then we have gustatory for taste, proprioception, that is for joint sense. These are type of a sense that will help you to position. And this is more common in kids because children do participate through play to help or rather to help them in child development. So if they have problems with proprioception, then therefore we'll experience some challenges which we'll be seeing as we get along. Then the other one is interoception. These are a sense that really it's responsible for self-regulation, or rather it's responsible for internal body organs. That's where a child can tell you, oh, mommy or daddy, I'm hungry, I want food, I want to go to the toilet. So sometimes, if they have those challenges again, they cannot be able, to perform toileting, they cannot be able, to feed, because there is a disconnect, or rather there is no communication. Very well, we hope you're together. So just to have a clear picture of what we've been talking is the 8 senses we have over there. So I just want to give you a scenario so that then you can get a clear picture of what we are talking about. Think of yourself driving probably, and you are caught up, in traffic jam like here in Kenya. You cannot make proceed, you cannot go back, you cannot, move side. That is the problem now. These children with the processing disorders do experience. So therefore, then it is going to affect the way they perceive information, the way they need to organize that information, modulate, organize, interpret, and give a feedback. So then that is the big animal in the room that we have. Then the causes for that, just to let you know, as of now, the cause is as known, but there are risk factors to that. One, it could be prenatal, could be birth complications, like the kids we've been receiving in our clinic. When we do our assessment, those are some of the things they tend to respond to. And you realize somehow during development, either before birth, during birth, and after birth, something happened. The other thing is environmental factors. And now the interesting thing is these sensory processing disorders are so many. I just decided to just pick a few which are quite common within our context. One, it's autism spectrum disorder, which is the leading, and then attention deficit hyperactive disorder. And then, of course, we have cases of intellectual disability and emotional disturbances. So what is the position of sensory processing disorder and mainly autism spectrum disorder? Because right now currently it's on a rise. So our position here is that the Autism Society of Kenya, which is a parent-driven organization that was established in 2013, believes it could be up to 4% or one autistic child for every 25 children. That was on 7th August 2019. Then a survey was done by Geopol and Koizora 2019, and a diagnosis was made where Kenyatta National Hospital had the highest percentage of diagnosis, being 14%. Nairobi Hospital was the second with a diagnosis. Of course, Nairobi Hospital 5% and Aga Khan 5%. That was 2019. Over time, in our department, we have seen the influx some of these conditions. So it's even more than that. Maybe we need to do more data. We see now what is the position of such condition. So therefore then, how does the sensory processing disorder chart look like? So up there, they fall under various categories. We have those who they are on the spectrum, but the problem they are experiencing, either they having challenges with modulation, and from that case you can be able to see we have sensory modulation disorder. Then the next one, we have sensory based motor disorders. These are kids who can, if you give like an activity, a simple activity like jump, they cannot be able to figure it out, you know. Then we have sensory discrimination disorders. We have also children that if you just call them, probably by the time they are getting information, you might tend to think either they are ignoring you, or maybe probably the information is taking too long, or I mean a short time. So then the response will be like the response can be there or it cannot be there. Then on sensory modulation disorder, it's also divided into sensory overresponsivity, which means in this sense means, for instance, if you have a child with a tactile or issues to do with touch, if you touch a child, the way they respond, the threshold is, it's very low, because then you realize it what happens is that you realize what is normal to everyone, for them it's something else. So then we have also others who have sensory under responsivity. Like if you just touch them, they don't experience anything, or they don't feel the touch. It could be touch, it could be pain. Then some of these kids, they do end up with a lot of problems, even like burns, because they cannot, be able to process the information correctly. Then we have those who have sensory craving. These are kids who can like play the whole day. They keep on jumping, and to them it's okay. So then again, that is a problem, because then you cannot, for a child, you cannot like play the whole day. You know. So when will the child go to class, settle down, listen to the teacher, which then brings the problems of like participation to work, and the work for kids in this case is schooling. Very good. So in our assessment, these are most commonly signs and symptoms of sensory processing disorders that we get from the clients or caregivers who come with the children in our clinic. uh, some of the parents, they will tell you like, I don't like, if a child can be able to express him or herself, they don't like brushing, which again we also need to remember it's an activity of daily living. So the others will be, I can be sensitive to light. So you can actually see some of the kids who tend to block their ears because what is within the environment is too much for them, and they cannot be able to self-regulate that. So then what happens? So this child cannot, get the information, do whatever it's supposed to do and expected to do, affecting the area of function. So others, they will present with poor fine motor skills. These are some of the children at school, they cannot be able to hold a pen because they have issues to do with the proprioceptive, where you need to position the hands, the joints need to work together. Then we have others like they tend to have preferences, you know, they don't like certain textures of clothes or rather food. They prefer to eat certain foods and to not other foods. Like Others we have had clients or children who like certain foods like oranges. A parent will tell you, my child cannot take a banana, but my child can only feed on like pure rice and nothing else. Then look at it in terms of nutrition, because then we are not having a balance there. Then the other thing is we have also children who like spinning, moving around. If you are doing like a cyclotron, like they'll go round and round and round, then you start wondering, where will this kid stop doing that? Okay, next one. So the role of occupational therapy in sensory processing disorder is as follows. That what we do as occupational therapists is informed by our models of practice, the frames of references and theories, and it is evidence-based. So even that when we are doing like our assessments, they are, we are guided by certain models of practice that have been proven to work. And maybe before that, I just want to give you a scenario. What happens, for instance, if children are referred to our department with a diagnosis of sensory processing disorders, we do an assessment. And the kind of an assessment we do here is a standardized assessment tool. Majorly we use sensory profile tool, which the caregiver or the therapist can be able to respond to, or if a caregiver is in a position to do that, they can be able to respond to. Then we interpret and we start setting, we set the goals together and we start working together. Then our plan here, after we set goals for kids, we said our tactile defensiveness, we tend, those who are uh, have sensory issues to do with the touch, we need to enhance, or rather we can reduce the tactile defensiveness so that they can be able to participate in everyday activities. We also need to improve on the tactile discrimination, because really if you cannot discriminate, you cannot discriminate a sense, then communication, there will be have a communication breakdown. Then the other one that we need to improve on the body awareness, because this will be used during play and other things, to improve the postural control, balance, gross motor. We need to participate them in crawling, jumping, then fine motor skills that could be because of maybe writing at school and playing with, toys, improve extension and flexion of joints. And some of them, of course, they do experience, they have like gravitational insecurity. So also we do work on that. And the bottom line of this, that we really want to work on the play, because we know the role, the importance of play in development of a child. Then what happens is that we do have a sensory integration room, or rather a gym, which certain activities do take place there. And the main aim here, we give a sensory diet for these children with sensory processing disorders. So basically, the point here is just to help them self-regulate, so that then they can be able to participate again in the occupations, or rather the activities of daily living. So these activities, they are arranged in three. One, we do alerting activities, which include, jumping on a trampoline. Sometimes we do give like a lot of exercises, creeping under the tunnels just to alert them. We have organizing activities like peeling of books, pushing heavy loads, getting into upside down. So it really gives them a good sense of balance. And then calming activities. So the plan here is when they are coming out of the session, you need to have done those 3 activities. So then there is a high quality of evidence that after they are able to self-regulate themselves, this child can be able to go to a school, settle down, concentrate, and do a task that probably has been presented by the teacher. That's a typical room. It's a sensory integration therapy that we have here in Kenyatta National Hospital. You can see there on working. We are working on the balance, the child there. Then there's another one. We are on the mat. We are doing high-hand coordination. This child can now be able to follow where the toy is coming from. Then again, you are working on the attention, the focus at the same time. And that's the end of it. So thank you very much for listening. I think I'll take back to Baron.
Well, thank you very much, Mr. Kaime. I believe it's a very educative presentation. I know most of us, I'm seeing chats, questions on the Q&A chat box. Kindly continue streaming your questions, and then we will be able to tackle them, by the end of, our presentation. Currently, I want to welcome Binti Hamisi. Binti Hamisi works at the mental health department as an occupational therapist here at Kenyatta National Hospital. And she's going to take us through the roles of OT in mental health, from adolescents, youths, adults to geriatric cases. I'm really, really interested in this. So welcome very much, Binti, and thank you.
Okay, good morning, everyone. Welcome, each and every one of you, in this presentation. We are happy to celebrate our OT week, focusing on mental health issues. As my colleagues have said, that mental health has become a major focus in the world. And it is upon us to stand up and face it and help our fellow Kenyans go through it. So I'll be taking you through the role of occupational therapists in mental health, and I will measure in the adult section. So I won't be talking on the conditions per se, but I will try and explain how we come in as occupational therapy as far as adult mental health is concerned. So my introduction, here you can see that there is a picture. This picture symbolizes our day-to-day activities. And that is what occupational therapy is mainly concerned with. So we have different roles as far as mental health is concerned. And I will talk about our role in mental health to our clients. Then I will continue to talk about our role in mental health with other professions, and then also in the country. So to our clients, our role includes screening of the patients so that we can identify any risk factors and if they qualify for our services. And then we continue. If they need our services, we proceed to assessments. And then we proceed to treatment planning, and later on treatment intervention, while incorporating our clients through the whole process. After we plan the treatment, then we need to follow up on our clients. We see if the treatment is working on them, is it adding any value in their life or it is not, so that in case it is not, or maybe they have overcome that treatment process or module, we can change it to something else that will be more helpful to them. Then after the reassessment, we also do, after reassessment, we do monitoring and follow-up to see what is happening with our clients, how they are coping with their day-to-day activities. And then after that, if they are fine enough, they can tackle their life-to-life, day-to-day activities, we discharge them. Then to our fellow professionals, our role here is to create awareness. Our fellow professionals should understand our role in the different settings that we work in. As my colleagues have said, we work in school, so we have to tell them, to show them our roles in school. When it comes to the health centers or the hospital settings, the different cadres of healthcare professions should understand what our role is as far as our patients are concerned. And the next role is to teamwork with them. After they are aware with our roles, we need to work as a team towards achieving the goals of our patients and to improve the outcome of our patients. So in the health profession and in other areas, occupational therapy complements the different cadres of professions. And our main goal is to achieve better outcomes, and our patients should feel fulfilled. My colleague who had introduced the presentation, he talked about Kenya, that the way it is committed to implement the comprehensive mental health action plan, which was planned since 2013, and it has to run up to 2030. So the occupational therapy here has a role, because when they are included in the task force, they can help the country to achieve the meaningful progress towards better mental health in Kenya. So occupations have been recognized by occupational therapists as fundamental to health, well-being, and identity since 1920. So why do we use occupations? Occupations promote learning. Like in school, when you do your occupations like writing, reading, this will help you to improve your intellectual skills. and hence be able to learn what you are taught and become a professional later on in life. The second reason why we use occupation is because occupations gives a person a role identity. For example, if you are a teacher, the occupation of being a teacher will give you a role identity as a teacher. If it's a doctor, a carpenter, a sports person, occupation will give you that identity. Everybody will know so and so is a footballer, is a singer, is a dancer. So that is how we also use occupation in occupational therapy. Another use of occupation is occupation provides structure and integration of a person. For example, when you wake up in the morning and you don't have any occupation, your day is empty. You don't know what to do. You just wake up, maybe you take breakfast, then you just sit the whole day and go back. And this mostly affects our mental health patients because of the way they have taken long maybe during their illnesses. So when they're in the treatment period, they don't participate in any occupations. So you will find that when they have healed, they still continue with the same routine of having empty routines. So that is when occupational therapists come in to help them structure their lives so that they can have a scheduled routine, and also to help them to integrate in the society. Like, for example, if it is a child in school, if it is an adult, you can help them integrate in the community or at workplaces. Another use of occupation is promoting recovery from illness and trauma. As occupational therapists, we say that if you engage in an occupation which is interesting and valuable to you, it will help you recover faster because you'll be doing what you want to do or what you need to do or what you are expected to do. And hence you'll be, like, for example, if it is a type of work, you'll be earning your living. At the same time, you are using it as a treatment mode. The other use of occupation is providing balance and meaning. As my colleagues have said, we have different categories of occupations. There are self-care activities, instrumental activities. We have education, work, leisure, social participation, sleep, and rest. So if you participate in all these occupations daily, they give you balance. For example, if you're not able to sleep or rest, as most of our mental health clients present with, you won't be able to function well the next day. So when you participate in the sleep and rest, this will give you balance on how you will organize your other occupations that will be facing the next day. It will also give your life a meaning. If you're not having any occupations to do, it means that your life is meaningless because you don't know where you are going to, what you have come from, what are your expectations. But when you engage in occupations, this will make you have a meaning in life. You want to work so that you can get money, you can support your family, you can maybe improve your health status, and so on and so forth. Another use of occupation is it reduces awareness of the physical or psychological symptoms. While you're performing the occupation that has a meaning in your life, you tend to forget the pain and the weaknesses that you have, and you work hard so that you can achieve that occupation. And at the long run, it reduces your symptoms. And the last use of occupation, it challenges you and changes the internal organism to promote adaptive response. So when you're doing such an occupation that you love, you enjoy doing, and maybe you are not able to do it because of some weaknesses or some strength. This will give you internal motivation so that you can participate in it and respond to whatever challenges it is giving you. So in occupational therapy, we have different areas that we assess. This helps us in planning the intervention and also in knowing which type of intervention will we use with this patient and what are the risk factors that we are supposed to consider while treating this patient. And these areas include the activities of daily living, as my colleagues have already mentioned them, that include the self-care activities, the basic things that we do that nobody thinks that they can come a time where you cannot be able to just hold a spoon and put it into your mouth, or just not feeling to eat or to take a shower, or even to participate in a wedding of your brother. So those are the areas. The other area is instrumental ADLs, environment. So under environment, we assess different types of environment. We have the physical environment, the social environment, the virtual environment, because we want to understand our client better so that we can know which type of treatment we can use. So we need to know all the environment that this person is engaging in and how we can help. Then we also assess the social participation skills. If the person is able to communicate, to maintain communication with other people, to participate in different community and family occasions, to be able to be in the middle of other people, and so on. We also assess communication skills, then the sensory skills. So in mental health, sensory skills include problems with which include hallucinations, illusions, and also there are some clients who present with tactile issues and also visual issues, auditory, even their smell, they feel like they smell something which is not there. Yeah, and under motor skills, we assess the muscle strength, the endurance, the muscle tone, and the muscle strength, so that we can know which activities we can give and how we can grade the activities for them to accomplish them. Then we also assess cognitive skills. And cognitive skills, we need to know how is your decision making, how is your problem solving, how is your judgment, do you have any memory issues like long-term memories, short-term memories, and then we also know how to go about them. In occupational therapy, we have both standardized assessment tools and non-standardized assessment tools. So in mental health, some of the OT assessment tools we use include the model of human occupation screening tool, occupational self-assessment tool. Then we also have the interest checklist, and we also use the International Classification of Functioning. Yes. Some of the modes of treatment that occupational therapists use, we use goal-oriented activities, and these activities need to be both goal-oriented to the patient and also to the therapist. Yeah, we also use ourselves therapeutically, depending on the type of patient and how they are presenting. We can be able to use ourselves to help them achieve their goals. We also use assistive technology. We have different devices that we use depending on your need. So it can be used to improve the processing skills. It can be used to improve your motor skills, sensory skills, also your performance skills, and also to improve your occupation the way you do. Then we also have ergonomics. This one we use mostly in industries or at workplaces, or we can also use in any other setting where we assess how the person is placed and their work and how we can redesign it so that they can work comfortably and achieve their goals. So in mental health, we help our patients who are adults in this case. We help them in their roles. A person can be a father, can be a sister, can be a firstborn, can be a mother. So their roles are different. For example, a mother needs to take care of the children. They make sure that the family is held together. But you will find that patients with mental health issues, they have either forgotten that they have such roles, or they know that they are supposed to do the roles, but they are not able to do it depending on the capabilities. We also assess, help them in their routines, day-to-day routines. Like I mentioned earlier, that most of them you will find they have empty routines. So we are able to schedule for them a routine that is healthy and it is helpful to them and it is geared towards the recovery. And we also need to understand their beliefs and habits so that when they are presenting with unhealthy habits, belief, we are able to take them back to reality and show them that whatever they are doing is not helping them, or it will maybe delay their recovery period, and also help them how to come into the good habits and work on them. And we do this in their different environments, which include the home, at work, and in the community. So how do we do this? We identify their capabilities, and then we also do skills and environment modifications and adaptations. And for those who are able to go back to work, we do work conditioning and work hardening. And then we also advocate for our clients in different sections. So some of the conditions in mental health that benefit from occupational therapy include personality disorders, mood disorders, psychotic disorders, post-traumatic stress disorders, and substance use disorders. So you will find this patient will present with different symptoms, like sensory issues, like I've mentioned earlier, the hallucinations and illusions. And then we have also motor issues, like maybe weak muscles, they have low endurance, they have low energy to participate in their day-to-day activities. And then most of them, you'll find that they have communications issues, like issues to do with their speech. They can have like pressured speech or maybe slurred speech, or something that communication mode that is not understandable to the other people. And some present with social participation issues. You'll find that a person cannot withstand being in the middle of other people, including their family members. So we also help them by gradually introducing them to participate in the social activities. So we can do this first as an individual, then later introduce few people at a time. Then we also have processing issues. So under this, you'll find that maybe a person can take like 3 hours to shower, or maybe to take a meal, or even to do a very small thing like writing a sentence. Or some of them may present with the inability to understand what is entailed in such activities. They don't know the sequence of those activities. So we also help in that. In mental health, occupational therapists use the functional model of disability and the recovery model, where we focus on what the patient can or what cannot do. Mythbuster. Occupational therapists are not people to occupy other people or patients. We are trained and we have a background of different science and arts that help us help our clients in their day-to-day activities. Thank you.
Are we still there? My question and answer chat box is really flowing, and I love this. Binti has mentioned something. Huh? She has talked about teletherapy in a way. And nowadays the world is going into a digital world. So the OT also can work with you in that sector. So I think that is the end of our presentations. So we will be able to take your questions so that now we can discuss, and then now we welcome you for tomorrow's event. We will only take a few minutes with that. My first question will be geared towards Mr. Kaimenyi. There is one participant asking, that is saying, amongst the sensory processing disorders, which one is more severe? Another question is sensory diet rather scientifically proven? Does it work for our clients? Maybe you can answer that, and then now we continue. Yes. Welcome. Just switch on your mic.
Okay. Sorry for that. Thank you, Mr. Baran. And yes, I was seeing a question, I think, from Dr. Ruth, asking among sensory processing disorders, which is more severe? This is my thinking is that usually when we do the assessment, we are doing the assessment, when we get a referral from a doctor, then we start screening and to see if the child really needs our services. This is my observation, that you realize some of these children, they have what we call complex needs, in the sense that a doctor might refer with a diagnosis of autism spectrum disorder. So down the line, you just realize the child is having challenges like anxiety disorder, learning disabilities. I think that way then it brings us the issue of it brings a challenge of when you want to intervene, because then we have so many problems. Then you also need to sit down and like how we are supposed to approach it. And now that's where we bring the interdisciplinary model, that we also need to sit down and see how we can be able to help this child. So in my own opinion is that I can't really see there's a, there's a certain sensory processing disorder. Maybe if I was to pick like autism or attention deficit hyperactive disorder and then compare the two and say autism is more severe than ADHD, I think I wouldn't really want to take that route. What I would say, every child is unique in this case. So you really need to look at what are the concerns, what are the caregivers' concerns, and a therapist, what is it? Because we have, we do use our clinical reasoning to try to understand then what is it that we can offer for this child. So I hope I've answered you correctly. Then the other question was from Derek Mzungu.
Yes.
Derek Mzungu is asking if sensory diet is scientifically proven. Maybe, sorry, what I forgot to mention is that many people think that when you are talking of sensory diet, we are talking of food. No, it's not. It's not food. Although we do work closely with the nutritionist to give advice in terms of diet, because some of these children, they do react with certain foods. So we really need to take care of that. So sensory diet in the context of sensory integration is that there are those activities, and these activities are targeting the brain, because the brain in this case has the issue. So this brain, these activities, I mentioned them. One is they are calming activities, heavy work, and calming activities. So we do have outcome measure. When we assess, we plan 12 sessions, then we review, we look at where are we. So yes, it is scientifically, it is evidence, it's working. Yeah. Thank you.
Thank you very much. I hope you being answered. Feel free to visit our department here at Kenyatta National Hospital, that is Occupational Therapy Department, for more clarification. There is another question from Agnes that says, a good presentation. So when you do home modification, who meets the cost? I will be able to answer this. The client will be able to have the cost covered because basically now we don't have that cover that will enable us to go home. But I believe that we are going to organize something and you will be able to be helped, because an OT is like a friend to you. I believe we'll be able to work together to tackle that. Another question is they're asking, which days are the pediatric occupational therapy clinic open? We are open from Monday to Friday working days. That is from 8 a.m. in the morning to 5 p.m. So you can always feel free to barge in and be helped. Another question, I'm actually going through the charts. That's why you're seeing I'm a little bit skeptical. One last question. There's anonymous attendee. They're saying, are OT services covered by NHIF? I mean, how do you charge? Thanks. Currently, we don't, NHIF does not cover OT cover, but we have the civil servants, people working in the police that are able to use their NHIF. And when you're coming for the assessment, the initial assessment, we do charge 1,450, and then now subsequent sessions, we will be charging 1,150. Yes, yes, Mr. Kaimenyi, you have anything to add? Can just unmute.
So maybe, thank you very much, Mr. Barrow. Maybe on the issue of NHIF, as per now, yes, we doesn't really, not unless it's the patients in outpatient, inpatient, it does that. It's covered by OT services. On outpatient, currently it's not possible, not unless you are civil servant. And then maybe what I wanted to clarify is we have our council that does regulation of occupational therapy. So what I know, there is a conversation ongoing on how we can work to include occupational therapy services in an NHIF cover. So it's a work in progress. Maybe we'll be giving details as we get along. Thank you.
Okay, thank you. There is 2 more questions for Binti. Maybe Binti, you can take us through those questions as we wrap up.
Yeah. Okay, welcome once more. So the first question reads, should OT be champions of justice, equity, and diversity and inclusion? My answer will be yes. This is because equity, diversity, and inclusion is it deals with the functional knowledge of others. And we as occupational therapists, we are trained to deal with any occupation, be it a juakali occupation, be it a sport, be it a white collar occupation. So we are at a higher level of helping our fellow professions when it comes to their occupations when they're not able to perform well at work. And that's why we have a background of occupational health and safety and the ergonomics, which guide us in how we can help any person to perform their occupation well. And as I mentioned earlier, in mental health, we say that we deal with what the client can do rather than focusing on their diagnosis. So when we do that, we are able to help this person come out from their point of maybe not in reality, not well-oriented, to a more improved state. The other question was, how can bipolar disorder patient benefit from occupational therapy? So a bipolar patient has 2 episodes. There is the manic phase, which present with high energy. Then they have reduced need to sleep. They have lost touch with reality. And the depression phase, they present with low energy. They have low motivation. They have lost interest in their day-to-day activities. So here, as an occupational therapist for the manic phase, I will plan and accommodate this patient and direct this high energy to a more meaningful occupation Like, for example, anything that will need that energy, for example, like digging or something that will utilize that energy, but in a positive way, such that by the end of the day, this person has benefited from the high end that they have. And also when it comes to the sleep, they don't want to sleep. They can sleep for only 1 hour or a few minutes. They just want to be awake all everywhere. So we have what we call sleep hygiene, which can help our patients to be able to sleep, because we do sleep assessment, we do sleep participation and sleep preparation. And for the depression, we also have activities that we can help them improve their energy and also motivate them to be interested to work in their daily activity. Thank you.
Thank you very much, Binti Habisi. We are rushing with time, that's why you're seeing we are trying to tackle a lot of things. But as I said, feel free to visit our department here at Kenyatta National Hospital, that is Occupational Therapy Department, and we have experts who will be able to help you. So mine is to welcome you to tomorrow's event. Tomorrow is the 27th of October 2022. It is the World Occupational Therapy Day. So I am inviting you guys to be in attendance. Our venue will be here at Kenyatta National Hospital, and the various some of the activities that we are going to undertake tomorrow. We will be having an official flagging of the ceremony by the CEO of Kenyatta National Hospital. We will be having awareness walk, that is, we'll be having a procession across Upper Hill area, Nairobi, just to create the awareness of OT. We will be having exhibitions of OT services, so you will be able now to understand in depth of what now OT occupational therapists do. We will be having a free disability screening. So spread the word and help somebody. Again, we'll be having a free registration with the National Councils for Persons with Disability. There'll be free registration. And then now basically we'll be having speeches from the different dignitaries. We have partners who have partnered with us at Kenyatta National Hospital.